Welcome back guys. Now in this video let's discuss about alveolar ventilation and pulmonary circulation. Okay. Now how to understand this concept? Alveolar ventilation means the amount of air that we are sending into the alveolus. Okay. Why we are sending the air? For the purpose of exchange. So air have to go into the alveolus for the purpose of gases exchange, and at the same time we have to send the blood, okay, for the purpose of oxygenation. Same, we are sending air into the lungs as well as we are sending blood into the lungs. So alveolar ventilation and pulmonary circulation. Alveolar ventilation is represented with the letter V. So what exactly is this alveolar ventilation, sir? Alveolar ventilation is the air going to the alveolus for exchange. Okay, the amount of air that reaches the alveolus for the purpose of exchange is alveolar ventilation. And what is the pulmonary circulation? Pulmonary circulation is the amount of air, it is the amount of blood that will be sent to the lungs, the amount of blood going to the lungs for the purpose of oxygenation. Now having said that, now let's discuss about the amount of, let's discuss about the first ventilation. Okay, first let's discuss about the ventilation. Now see, what is the environmental pressure or what is the atmospheric pressure? Okay, we are discussing about the ventilation. In the topic of ventilation, first let's start from the environment. In the environment, the pressure is somewhere around 760 mmHg. We have to take it as zero atmospheric pressure. The 760 mmHg pressure is considered as zero atmospheric pressure. Now, let's talk about the composition of environmental air. In the environment, not only oxygen is present, nitrogen is present. Nitrogen is a major gas. Most of the students will think oxygen is having the major composition. No. In the environment, nitrogen composition is 79%. Oxygen composition is 21%. If you see in the fractions means like in the 0 point. Okay. So the fractional concentration of oxygen is 0.21%. Now let's talk about the carbon dioxide. Carbon dioxide, it is almost nil. Okay, so for practical purposes we are taking it as 0. So what is the concentration or what is the composition? How much is nitrogen? It is 79%, oxygen is 21%, carbon dioxide is taken as 0, nil. Having said that, now let's discuss about the topic of partial pressure. Sir, in the environment there are different gases present. All gases contribute to 760 mmHg. Okay, the 760 mmHg is because of oxygen, nitrogen and all the gases all the gases contribute to 760 mmHg. Now, if I am talking about one individual gas, sir, how much pressure is contributed by the oxygen? That's the partial pressure. The pressure exerted by an individual gas. Pressure exerted by individual gas is the partial pressure. Now let's see the partial pressure of oxygen, PO2, the partial pressure of oxygen in the environmental air. How to calculate it? Just simple. Atmospheric pressure into fractional concentration of oxygen, that is 760 into 0.21. How much? 160 mmHg. So now tell me, in the environment, what is the partial pressure of oxygen? The partial pressure of oxygen is 160 mmHg. If oxygen is contributing 160 mmHg, then how much is from the nitrogen? Sir, out of 760, 160 is contributed by oxygen. So automatically 600 is contributed by the nitrogen, or the partial pressure of nitrogen in the environment is 600 mmHg. Now, after this, let's talk about the movement of air, air from the environment. Okay, oxygen from the environment will move into the respiratory tract. From there, it will go into the alveolus. Now let's see, in the environmental air, the partial pressure of oxygen is 160 mmHg. We have discussed about this. Now, when the air is passing through the respiratory tract, it will undergo humidification. Okay, so to decrease the temperature of the air, humidification will occur. Okay, because of the water vapor. Now remember, try to understand like this. Now, whenever oxygen meets with the water, oxygen will be dissolved in the water. So, when oxygen is getting dissolved in the water, what happened to the partial pressure of oxygen? The partial pressure of oxygen will decrease. So, that's why in the inspiratory air, the partial pressure of oxygen, see, PiO2 means the partial pressure of oxygen in the inspired air, it is not 160 mmHg, it is 150 mmHg. Okay, we know the partial pressure of oxygen in the inspired air is 150 mmHg. But how to calculate it? So calculation of PiO2 is equal to FiO2, okay, FiO2 into atmospheric pressure minus water vapor pressure. Okay, so FiO2 value is how much we know? The fractional concentration of oxygen. The fractional concentration of oxygen is 0.21. We know the atmospheric pressure 760 mmHg. Now minus 760 mm minus what is the water vapor pressure? So the water vapor pressure is 747 mmHg. Okay, 47. So 0.21 into 713. 760 minus 47 is 713. So 0.21 into 713 is 150 mmHg. So the partial pressure of oxygen in the inspired air is 150 mmHg. The formula for PiO2 is FiO2 into atmospheric pressure minus water vapor pressure. Okay. Now see this air when it comes to the alveolus. Okay, it have to pass all the down from the trachea, bronchi, bronchioles. Okay, it have to come to the level of alveolus. When the air is passing down all this way, now the partial pressure of oxygen decreases. Okay, in the mucous lining some oxygen will be dissolved. Okay, so at the end the partial pressure of oxygen in the alveolus is not 160 mmHg, it's not 150 mmHg, it will be 104 mmHg, or just round figure you can take it as 100 mmHg. So the partial pressure of oxygen in the alveolar air is 104 mmHg. Now how to calculate it? See, we know inspiratory air, partial pressure of oxygen in the inspiratory air is 150 mmHg. Now partial pressure of oxygen in the alveolus, if you want to calculate it, the formula is PaO2, the partial pressure of oxygen in the alveolus, is equal to PiO2. Okay, in the question they will give you this value. Okay, they will ask you to calculate it. So PiO2 minus PaCO2 by RER, respiratory exchange ratio. These are like these values you will get. Okay, respiratory exchange ratio, it's a constant value. Okay, so alveolar gas equation will tell you. Okay, alveolar gas equation will tell you the partial pressure of oxygen in the alveolus. Okay, now let's see this one question. See, in this question, a 70-year-old man with a severe respiratory distress is placed on the ventilator. His FiO2 is 0.5 and his ABG reveals a PO2 of 160 mmHg, PCO2 of 40 mmHg. What is the alveolar oxygen tension? Alveolar oxygen tension means the partial pressure of oxygen in the alveolus. So which formula we have to use? We have to use the alveolar gas equation. And the atmospheric pressure in this case is given as 747 mmHg and the respiratory exchange ratio is 0.8. Now how to calculate? See, PaO2 is equal to PiO2 minus PaCO2 by RER. Now my question to you is, sir, in this question have they ever mentioned about PiO2? They haven't gave any value regarding the PiO2. PiO2 was not given in the question. So how to calculate the PiO2? I already know the formula. PiO2 is equal to FiO2 into atmospheric pressure minus water vapor pressure. Now see, in this question they have given the fractional concentration of oxygen. The FiO2 in this case is, the FiO2 is 0.5. Okay, so 0.5 into atmospheric pressure is 747 minus water vapor pressure is 47. So 0.5 into 747 minus 47. First of all, let's do this. 747 minus 47 is how much? 700, sir. Okay, so 0.5 into 700 is 350. So we have calculated PiO2. So PiO2 is 350. Okay. Now in this question, have they gave PaCO2? Yes, they gave PaCO2 value. The PaCO2 value is 40 mmHg. 40 mmHg. So PaCO2 is 40. Respiratory exchange ratio is 0.8. 40 divided by 0.8 is 50. So 350 minus 50 is 300. So in this case, the partial pressure of oxygen in the alveolus is 300. Okay. So this is how you have to calculate the partial pressure of oxygen in the alveolus by using alveolar gas equation. Very important formula for the exam. Now after this, let's discuss about the concept of minute ventilation. What is minute ventilation? Every minute, how much air is going into your lungs? See, every minute how much air is going into your lungs is the minute ventilation. So minute ventilation is equal to tidal volume into respiratory rate per minute. What is the tidal volume? The tidal volume is 500 ml into what is the respiratory rate? 12 breaths per minute. Okay, so 500 into 12 is 6 liters. Okay, 500 into 12 is 6 liters. So try to understand like this. Every minute we put 6 liters of air, or every minute we send 6 liters of air into our lungs. Okay, but this is minute ventilation. Now think logically and tell me. Now we are sending 6 liters of air, but all the 6 liters of air is reaching alveolus? No. Why? Because see, tidal volume is 500 ml, no doubt. Out of this 500 ml, we have discussed 150 ml is wasted away. Why? Because 150 ml is present in the conducting zone. In the conducting zone, there is no exchange of gases. If there is no exchange of gases, you have to consider dead space. Okay, so out of 500 ml, 150 ml is wasted away. Okay, with every breath, 150 ml is wasted away. Now, how many times we are breathing? 12 times. So, 150 into 12 is 1800 ml. So 1800 ml is what? It's a dead space ventilation. Okay, every minute how much air you are keeping into your dead space or into the conducting zone? 1800 ml. Okay, now let's talk about the amount of air that actually goes to your alveolus. If you remove 150, what is left over? 350. So 350 ml of air is reaching the alveolus with every breath. How many breaths you are taking? You are taking 12 breaths, so 350 into 12 is equal to 4200 ml. So this is the amount of air that reaches the alveolus every minute. So this is the alveolar ventilation. Alveolar ventilation is how much? Alveolar ventilation is 4200 ml. What is the dead space ventilation? Dead space ventilation is 1800 ml. What is the total ventilation? Minute ventilation. Minute ventilation is 6 liters per minute. Okay, having said that, now let's discuss about dead space. How many dead spaces are there? There are 3 different types of dead spaces. One you already know, that's the anatomical dead space. Okay, anatomical dead space, which is nothing but the conducting zone. How much ml? 150 ml is, okay, 150 ml. Now what is alveolar dead space? Alveolar dead space means simple. Understand like this. Alveolus, or I should say there is some alveolar damage. Because of some alveolar damage, now exchange of gases is not happening. Okay, so alveolar dead space is an absolute pathology which is not seen in healthy individuals. Okay, now alveolar dead space is always pathological, absent in healthy individuals. Now what is physiological dead space? Physiological dead space is equal to anatomical dead space plus alveolar dead space. Anatomical dead space plus alveolar dead space. How much is anatomical dead space? Anatomical dead space is 150 ml. How much is alveolar dead space? Alveolar dead space is 0. Okay, in healthy individuals it is 0. So 150 plus 0 is 150 ml. So in a healthy individual, anatomical dead space and physiological dead space, they are one and the same. Okay, it's 150 ml. That's it. Okay, now see, in healthy individuals, physiological dead space is equal to anatomical dead space. Okay, now let's see some important questions which will come in your exam. How to calculate this anatomical dead space? Anatomical dead space measurement, we know anatomical dead space is 150 ml, but there is a method with which the anatomical dead space is calculated. The name of this method is called as single breath nitrogen method, which is also called as a Fowler's method. So Fowler's method and single breath nitrogen method are used to calculate the anatomical dead space, and for calculating the physiological dead space there is an equation which is called as Bohr's equation. Bohr's equation. So Bohr's equation is equal to, okay, Bohr's equation is equal to tidal volume into PaCO2. Tidal volume into PaCO2. In the question they will give you these values. What is the PaCO2? Okay, what is PeCO2? These values they will give you. So tidal volume into PaCO2 minus PeCO2 by PaCO2. Simple. PaCO2 minus PeCO2 by PaCO2 is the Bohr's equation which is used to calculate the physiological dead space. Okay guys, hope the video is helpful. See you in the next video. Thank you.